A lot of you have been asking me, how do I prepare for NEET SS in 60 days? So I'm assuming that you guys have started your preparation and are starting your revision, or are somewhere midway between your preparation. That is, you have prepared, half so and so, and now you want to intensify your preparation in 60 days. So the plan I'm going to tell is intended for people who are preparing very seriously, people who are trying to prepare full time, are not working from a 9 to 5 job or something of that sort. And this is the weightage you should give for the topics. So how much time should you spend on each system? The biggest focus, the biggest chunk of your preparation is going to be occupied by gastrointestinal surgery. You will have to allocate 15 days in these 60 days for GI surgery. Why so much representation for GI surgery? Because GI surgery is going to take the bulk of your time. A significant amount of questions in general surgery appear from GI surgery, and GI surgery is something you should prepare from Bailey and Lau, Sabiston, and the question bank, and if possible the searchless videos also thoroughly. If you have not revised or studied the Sabiston textbook of surgery at all before, I would suggest that you don't start right now. Read from Bailey and Lau and use the searchless videos to supplement your preparation, because it contains all the information from Sabiston, a little bit of information from Shackelford and Blumgard as well. But if your preparation is so and so, then at least 15 days for GI surgery is something you would need to revise all the topics, because it is a big chunk of there's a huge weightage for GI surgery in your exams. Basics of general surgery, including pediatric surgery, principles of oncology, diagnostic endoscopy, preoperative, perioperative care. Now this is going to take at least 7 days. The core of your preparation is going to be Bailey and Lau, supplemented by the searchless question bank. Urology, including transplant, you should not be taking anything more than 4 days. Urology, use Bailey and Lau only. For transplant, Bailey and Lau, the recent edition is good enough. If you have not had time to go through it, watch our updates video on the Bailey and Lau 28th edition updates video package on the app. For those who are interested in top ranks, try to read liver transplant and intestinal transplant from Sabiston also. Now, this is going to occupy at least 26 days of your preparation. In the rest of the 4 days, you should do neurosurgery, plastic surgery, head and neck surgery, CTVS, and vascular. For most of it, only Bailey and Lau is enough. For those who are interested in going a little extra mile, vascular alone you can read from Sabiston, but that's for people who are aiming at the top 50 ranks or something. For rest of them all, neuro, plastic, head and neck, CTVS, and vascular from Bailey and Lau is more than enough. And all the miscellaneous other topics you can take 1 to 2 days. So you've already spent around 30 to 32 days on your preparation. Have a reasonable idea about how to interpret a CT scan for common conditions: chronic pancreatitis, pancreatic malignancies, liver trauma, renal trauma, hydatid cyst, common conditions in the luminal pathology. How would you identify pneumatosis intestinalis? I'll make a separate video where I talk about what are the conditions you should look for or learn in a CT scan, learn to identify from an exam perspective. Also learn a little bit about MRCP, basically how to identify cholangiocarcinoma and how to identify a CBD calculus is more than enough. You wouldn't need anything more in MRCP per se. And how many MCQs to solve every day? I think the focus should be on solving as many MCQs per day. For my students, I would recommend solving at least 100 MCQs a day, which means that you will be able to go through the searchless MCQ question bank in a span of around 30 days. And for me, that is non-negotiable. One thing, common trait among the top rankers whom I have interacted with over the past 3 to 4 years is that they've all spent a lot of time solving MCQs repeatedly. And if you look at the top 20 rankers in every specialty, especially surgery, which I know and understand, a common trait is that most of them, not all of them obviously, but most of them have at least solved the searchless question bank twice or thrice, and that remains the mainstay of your preparation. So when you wake up, solve 5 to 10 MCQs. Before sleeping, solve around 10 MCQs. When you are spending some time chilling out and you don't want to actually read, or your mind is clouded with thoughts or something else, solve 5 MCQs. Use the filters on the app which says MCQs which are not solved, MCQs I've made a mistake in, and that should be the basis of your preparation. The MCQ bank is almost 80 to 90% updated with 20th edition. Only a few chapters are left where the older MCQs are there, and that's also something which you're updating right now. And this should be the core of your preparation. So I'm just going to go back again just to recapitulate. GI surgery 15 days from both Bailey and Sabiston. Basics including pediatric surgery, perioperative care, diagnostic endoscopy, imaging. That should be around 7 days. Transplant plus urology from Bailey and Love 4 days. Neurosurgery, plastic, head and neck, CTVS and vascular combined 4 days. All other miscellaneous topics should take not more than 2 days. You can have a look at our Bailey and Love videos to understand the basics of OBG and ortho also for general surgeons, and that's from Bailey and Love. So that's all you need to read these topics which you may not have the inclination to read or understand. So when these 32 days are over, what should you do next? You basically do the same thing again and again and again, and the second revision is not going to take you more than 15 to 17 days. And then what do you do the last 10 to 12 days? So my advice would be to again repeat the cycle, and this time it's not going to take you more than 7 days. You'll have to rapidly rush through things, go through the same things again and again, and during the next 30 days, you will again be solving MCQs. Every day you'll be solving MCQs. This time you'll be solving MCQs which are bookmarked, where you feel you've made mistakes. You'll be solving MCQs which you feel you've answered wrong. And that's how your preparation is going to be. So at the end, you'll be left with 3 to 4 days in your hand, and that is going to be your free time when you want to read topics which you feel are difficult and which you feel that it needs a little bit of emphasis at the end. And that for most people is going to be tables in Bailey and Love, tables in Sabiston, topics such as radiation doses of various investigation modalities, ABG, understanding biostatistics. So this is going to be what you're going to be revising in the last 3 days. And that's it. I think that concludes the bulk of your preparation. I'll be posting this video on YouTube, and you can ask all your doubts in the comments, and I'll be definitely willing to answer them all. I wish you all the very best in your preparation. The current NEET assess pattern means that all of you have a very good chance of getting a super specialty seat. You are not restricted by specialty right at the starting itself. So I would request all of you to put in your 110% into your preparation. Read coolly, read with a calm mind, but always make sure that you read with a lot of focus, and make sure that you are able to, concentrate as much as possible during the time you're reading, because in this modern era, attention span and focus are a major challenge. And I'm sure you guys are at the top of your game. You guys are some of the best surgeons in the whole country, and I hope and pray that you get the seat of your choice. Thank you so much, guys.